Welcome to Fertile Forward. I'm Sadie Minkoff with Sage Acupuncture, and I am honored today to be speaking with Dr. Andrea Campaigne here in Austin. She is the head of ARC North Austin OBGYN and has been the head of Nurture OBGYN for many years, where she has established herself as one of the most loved OBs in the city. She also has won several Frist Humanitarian Awards and has been named one of the top Austin doctors for 2020, in addition to being the chief of OB at North Austin Medical Center. So welcome, Dr. Campaigne.
Thank you, Sadie. It's so good to join you.
Thank you. So to start off with, just to get to know you a little bit, can you tell us how you got interested in this area of medicine?
Yeah, that's a good story. I love to use the words that it wasn't a light bulb moment for me. I went to medical school, particularly really desiring to be a family physician. My family had a wonderful family physician for over 30 years who took care of 3 generations of my family, and I thought that's what it meant to be a doctor. And when I did my women's health rotation, my OB rotation in particular, I remember crystal clear everyone asks this question, the day that I saw my first baby be born, my eyes were darting around the room at all of the players, support people, wizened labor and delivery nurse, young intern, experienced chief resident. My eyes were darting around the room watching the kind of temperament of all the players. And the chief resident was standing with their back against the wall, watching all the other people work, knowing that they were kind of there in case anything happened, that they did not act and they did not raise their voice, but they were there just in case with all the kind of plans and answers. And I loved that the kind of day proceeded as it was intended and with all the emotion present, and it went well, that delivery. But I looked at that person holding that space and I thought, I want to be like that person. I still hold the space like that in my professional work.
Nice. I feel like you are actually well known for holding space specifically. Mm-hmm. And today our topic is fertility and mm-hmm. struggling with fertility. Mm-hmm. And so I would love to hear how you approach that specific stage of a person's process through their life, and really about what does it look like when somebody comes to you specifically for fertility, and how do you guide them through that process and also hold space during that time?
Yeah. And not to answer that too indirectly, one of my favorite ways of sort of starting the conversation, some women ask the question with that they're sort of not ready, but they're asking this open-ended assessment that sort of asks if I'm holding all the cards to be able to promise it at some future date. And what I like to help them understand is that I'm not the plan maker, that's for sure. And really another core value of mine is meeting women where they're at. And there's not a good, body scan for fertility, especially for sort of future, telling. There's no crystal ball for it. So when I love that you also use the word, you and I have worked together for a long time and on patients together. And I think we share patients for obvious reasons, that they kind of can see some of the same values in us. One of my favorite ways to start the conversation with patients, a lot of them will say sort of like, I'm worried about infertility. And I always start right then at ground zero and say, can we start by calling it fertility? Do you know what I mean? Can we allow it to be an open-ended and possibly optimistic opportunity, something that maybe we don't know yet, but it is out there for you? And I don't like for women to sort of wear the identity of infertility, even though I know many women who have gone through a long journey with their fertility. I like to sort of start by reframing their own words, kind of their empowerment about it. So that's one thing that I wanted to mention. However, my other sort of one of the first conversations I like to have is, especially for sort of modern planning type A go-getters,
Which is all of us.
that's all of us, right? That fertility, the way I've always explained it, is that fertility is, one of the words that I use is, it's something that you have to be receptive to. It's not something that I think you go out and get, that you go out and achieve. You can't study hard and be good at it, right? It is something that you open yourself up to and create space for, so that the right opportunity comes to you. And I know there are women who, again, with a long journey, might have said, hey, I created a lot of space. I was in the right headspace and it didn't come to me. So I'm not saying that's the only answer every time, but I think it's really important right at the foundation to get women out of the headspace of micromanagement and a lot of sort of control, because I personally think that kind of acts counter to the process. I think they need to kind of shed that identity and sort of allow a bigger plan to be present.
Right. Yeah, I totally agree, and have similar conversations with people that, at a certain stage, you have to hold both things. You have to show up for the appointments and do your due diligence and be really well educated, so you're making good choices about your body. But at the same time, this is not the same old process where the harder you work, the better the outcomes.
That's right.
And so it's really challenging, I think, for many people to maybe do the same outward motions, but the inward work is as important as that.
Yeah, I agree. That's a great way of saying it. That kind of giving up, giving in, leaning in, all of that, that work. Even, I know that you share it, but even just the gentle practice of kind of, meditating or something, kind of saying, I did all my academic research, I have my appointments, and now I just need to release, in a day. We talk about that balance, that yin and yang all the time.
Yeah. And I love that you, in your medical practice, are acknowledging that and supporting, in your patients.
Yeah.
So then, to sort of get down to the nitty gritty.
Yes.
When someone comes to you and they're ready, what are you looking for to assess next steps for them?
For potential. I mean, on a really, really practical plane, my approach is usually quite tempered and pragmatic. I love to give nature time. So we often will have just a first kind of conversation about identifying any obvious barriers. And I can talk more about that in a second, but if there are no obvious barriers, and the woman has a regular period, we can talk more about that in a second too. I love to coach that it takes normal people a certain amount of time to become pregnant, that they really do want to hold that space for the one that does come to them, that no one's better than anyone else, in terms of who gets pregnant in their third cycle or their ninth cycle. So for most couples in whom the woman has a regular period, we'll talk about a time frame of up to 12. It's interesting because it's usually translated 12 months. I'm very quick to say that it's actually 12 ovulatory tries, right? And some people say, what does that mean? And we can, then we talk in our work, obviously, as the OB-GYN, about what it means to help her identify ovulation, right? Regular periods, and my definition of regular periods is any period that occurs on sort of a 26 to 40 day cycle. I view women as representing a beautiful bell curve of experiences. And just like we don't all have the same shoe size, I don't think we all ovulate on the same day. And I think we can be fertile as day 12 ovulators or day 20 ovulators. It just takes a sort of awareness of where you fit on the bell curve, to become kind of aware of your fertile pattern. I love talking about that bell curve and helping women be where they are. So if a woman has a 35-day cycle, she might only ovulate 9 times in a 12-month calendar period. So if she's holding herself to really strict boundaries around that, I don't want her to feel like she's being let down. I want to enable her to like look at the possibility in her cycle and really allow for 12 ovulatory tries. When we get to the testing that we can do in the office, there's a lot being made right now of something called day 3 labs, or ovulation sort of prediction. This idea that we at the office can check on the signal that's coming from the brain to the ovary, to see how strong and reliable that signal is. It's still just one point in time. So I have definitely across a woman's, year even seen sort of lab values that seem like negative predictors maybe, but that with any degree of changes in her life, we can modify the strength of that signal to her ovulation, such as with things like acupuncture, by the way, so it's not it doesn't represent her identity. It's not that most women in whom maybe we identify any barriers to ovulation meet a kind of absolute criteria or anything like early menopause, which I hear from women all the time. But yes, though, that kind of round of testing is to identify more women who might be in the department of kind of having true barriers, whether that's simple, what I think of as simple diagnoses like polycystic ovarian syndrome, or kind of any sort of metabolically related pattern of sort of dysfunctional ovulation, to more worrisome barriers like age-related changes to the strength of the ovulatory signal, things that might really need intervention. So that is a little bit in a nutshell ovulation. Every time, I mean, that's obviously the waters that I swim in most comfortably. I love women's health. I love sort of our hormonal symphony that makes us tick. I can talk about that all day long, but it's equally important to me as a woman kind of asks me, can you check me, to talk about that there are 2 other really important components to fertility. So every time we talk about, even on a very simple or more esoteric plane, evaluating ovulation, I simultaneously talk about how possibly flawed spermatogenesis is. It's not a given. I know there are lots of jokes made about sort of it only takes 1 in a million, but the whole, I mean, on a simple basis, like a lot of men in Austin, a lot of men's health movements right now are moving towards putting men on testosterone. And I'm seeing a lot of partners on testosterone lately. And testosterone has a really, really clear negative impact on a man's fertility. That's a simple and luckily reversible impact on a man's fertility that we sometimes just kind of nip in the bud at the educational level, but it might spare the female partner from undergoing a sort of journey or a degree of testing that she doesn't warrant, to identify that in the first place. So semen analysis is something I can run, not me personally, of course, but as the woman's doctor, I can be the ordering physician on behalf of the couple to evaluate that. So that's a part of the dialogue that we do all the time.
Yeah, that's really an important piece.
Mm-hmm.
And that people know that you have that capacity is
Mm-hmm.
really important. Men's fertility is as impactful on success as the woman's.
That's exactly right.
Fertility is really the only thing that you treat somebody else for your problem ultimately, right?
That's
So it's fascinating in that way. And male fertility is a huge topic, just in that globally it's declining dramatically.
That's right.
Some reason, which is really interesting. So I appreciate you really bringing that up. And again, the holism in your work that you're really looking at, really educating people. Where are blind spots? Is it just a matter of getting the timing right? If you're ovulating on day 20 and you're having intercourse on day 14, that's not going to necessarily work out in our favor.
Right.
So just checking all the boxes. And so if somebody has a question, it sounds like am I on the right track? You're the person to go to.
Yeah. I mean, I love fixes that are individualized to that couple, that aren't, I think every woman thinks they're in the worst case scenario before I even identify the sort of simple and unique things about them.
Yeah. So then if let's say you do feel like some intervention is necessary,
Mhm.
um, what would you do for them? And when would you say, you know what, maybe it's time to move on to like a reproductive endocrinologist or something?
Yeah, I kind of talk from the beginning about that really they're in the position to decide how much time they want to spend with me and how soon they want other options. So um, I almost always talk about sort of the work that I can do. I mean, one further step in the workup that we haven't talked about is the role of either HSG or like hysteroscopy to evaluate her anatomy and her tubes, which of course that's the last horizon, is if she has an egg and he makes good sperm, where do they meet in the middle and how does implantation go? Equally interesting and important to me. When HSG is done in the workup for a fertility assessment, you know, there is documented benefit that there is an increased pregnancy success rate in the next cycles that follow, you know, for reasons that I think Western medicine doesn't sort of explain well, but it's interesting and functional. So when we get to the point of a woman asking for a fertility assessment, I'm not afraid to take that step because I like the idea of the increased pregnancy success that follows it. And I always talk to her about like capitalizing on that opportunity. But that's usually after we've identified, you know, healthy ovulation and healthy sperm. And I know you know this, but I'll tell sort of the listeners, I value the role that acupuncture plays in fertility. I am a fairly East meets West kind of a thinker. It's something that I have incorporated from my family traditions. It's the way I am as a person. It's the way I am as a practitioner, not only in fertility, but kind of in the treatment plan for all things. I think women taking sort of responsibility and empowerment about their fertility journey is important. And I think acupuncture is a part of that. I think acupuncture is, and I might be doing it a disservice and not explaining it the way you do, but this is the way I tell patients. I think it's a beautiful and sort of whole body focused pathway. So when they get down to that really sort of controlling, analytical, can you fix this about their fertility, I think reminding them that doing acupuncture as an overarching investment is a really important sort of whole body solution. It's really a wonderful, proactive, very them-centered, you know, it creates the right space for them to be fertile, whether they are moving forward with other interventions or not. So I always talk to them, you know, maybe they just want a season of 90 days or 120 days of doing acupuncture before we move on with the Western methods. Sometimes we invest in acupuncture coincident with doing the Western methods. When I refer to Western methods, you know, we're comfortable in our office as kind of general practice OB-GYNs. And this is not true for every general practice OB-GYN. This is the style of our practice at encouraging ovulation induction. So doing a few things, whether they actually be sort of herbal or medicinal, to encourage more quality ovulation and maybe even some monitoring of that ovulation, like looking with a transvaginal ultrasound at the size of follicles and sort of the readiness of those follicles, the maturity. But we have wonderful infertility specialists in this town, ones that I really value. And I talk almost right from the beginning, especially if I identify barriers or if a woman's timeline warrants it, that going to get a consultation with an infertility expert, even if it's just to frame and hear the options, right? To give them space to think over the next 6 to 12 months about the options, is, I think, always a worthwhile conversation. So it's not something I like hold back from, you know. I don't want it to be the last horizon, right? I want it to be like, they're a proactive part of the team. You might want to hear what they have to say, and not something I'm holding people from. The only other sort of horizon that we haven't really talked about is, of course, and this is really a strong core value for me as well, there is no one way to make a family. There is no right way to make a family. Families, I have seen so many different kinds of families be made. There is no right spacing for families. I mean, we have so many same-sex couples. We have so many women do pregnancy on their own. I have women who do pregnancy on their own and specifically want twins out of that pregnancy. I mean, there is just no right way to make a family. If anyone is desiring to even have the conversation about what it would look like in their life, and they think that they look different from another patient sitting in a waiting room, please don't let that stop you, because we're in Austin, Texas. There's a lot of amazing people in Austin, Texas who can talk to you about what makes your opportunity unique and help you on the journey if making a family is what you want to do. Because I also have an amazing 3 and 5-year-old who I had a little bit close to 40 actually, after spending 10 years starting my career. And yeah, don't think that there's any right way or any barriers that are kind of too hard for those of us that do work in the field and have seen sort of role models come before you to help you navigate.
Lots of good resources, and
Yeah.
you're among the top, so thank you.
Thanks.
What's interesting to me is that I don't know how many people know this about you, but you have a degree in art history.
I do.
Yeah.
Yeah.
Which sounds, after this conversation, like it just has informed your medical practice. Would you say that's accurate?
It's so funny. I just got goosebumps to say thank you for bringing that up and for saying it like that. I very squarely, and I'm so grateful for it. I very squarely received early in my academic career a real imperative to be well-rounded is the word, right? And everyone who was good pre-med advisors to me said that will only benefit you when it comes time to apply to medical school. It's a little bit. Yeah.
Well, thank you. And it's
Yeah.
very apparent in your work that you love to learn, and
Yeah.
you bring so much of yourself and so many interesting facets about life in general to your practice of medicine.
Thank
So
you.
thank you so much.